Hello, everyone. My name is Mina Erickson, and I'm excited to present my capstone project on a critical aspect of anesthesia management. Today, I'll be discussing the prevention of hypotension during spinal anesthesia, particularly in OB patients. This is a significant concern in obstetric anesthesia as managing BP effectively is crucial for both maternal and fetal health. In this presentation, we'll start by briefly reviewing spinal anesthesia, its advantages and disadvantages, before delving into the mechanism of action of ondansetron. We will also discuss why vasopressors are not ideal for parturients and look at the evidence supporting ondansetron's use. Finally, we'll conclude with the implications of these findings and a call to action for clinical practice. Let's begin by discussing spinal anesthesia and its key advantages, particularly in the context of obstetric procedures. As we know, spinal anesthesia is one of the most commonly used techniques for C-sections and surgeries involving the lower abdomen. It offers several benefits that make it highly suitable for parturients or OB patients. Firstly, spinal anesthesia provides rapid pain relief by effectively blocking nerve signals from the lower part of the body. This rapid onset of action is crucial during labor and delivery, ensuring that the mother remains comfortable. Another significant advantage is that spinal anesthesia allows the parturients to stay awake and alert during the procedure, which is often preferred during childbirth, as it allows the mother to experience the birth of her child without the discomfort of labor pains. Additionally, spinal anesthesia has minimal effects on the newborn because the local anesthetic used doesn't significantly cross the placenta. This minimizes any potential impact on the baby, making it a safe choice for both the mother and the infant. While spinal anesthesia has many advantages, it is also important to be aware of its potential disadvantages, especially in obstetric patients. One of the most common complications associated with spinal anesthesia is hypotension, which occurs in about 80% of obstetric patients. And this drop in blood pressure happens because spinal anesthesia blocks the sympathetic nerves, which are responsible for maintaining blood vessel tone and blood pressure. While these nerves are blocked, or when these nerves are blocked, the blood vessels relax and widen, leading to a decrease in blood return to the heart. This reduction in blood flow back to the heart triggers a reflex called basal-gerish reflex that is partly mediated by certain receptors in the body known as the 5-HT3 receptors. As a result, there's an increase in vagal tone, which is the body's way of slowing down the heart. This can lead to bradycardia and ultimately make the blood pressure even worse. This complication is particularly concerning because it can affect both the mother and the baby if not managed properly. Therefore, understanding and managing the risk of hypotension during spinal anesthesia is crucial in obstetric care. Now let's explore how ondansetron works, particularly in the context of preventing hypotension during spinal anesthesia. Ondansetron is primarily known as a selective serotonin 5-HT3 receptor antagonist. What this means is that it specifically blocks certain serotonin receptors located on the vagal nerve terminals, and within the central nervous system. These serotonin receptors are involved in a reflex known as the basal-gyrus reflex, which is a cardiovascular response that can lead to low blood pressure and a slow heart rate, especially during spinal anesthesia. When spinal anesthesia is administered, it can trigger this reflex, leading to a significant drop in blood pressure and heart rate. Obviously, these are the two outcomes we want to avoid, particularly in obstetric patients. Now, recent studies have shown that ondansetron can help modulate this reflex by blocking the serotonin receptors involved. Ondansetron helps prevent the exaggerated vagal response that can cause bradycardia and hypotension. So, in essence, it helps maintain more stable blood pressure levels during spinal anesthesia, reducing the risk of complications for both the mother and the baby. Now, let's discuss challenges of vasopressor use in parturients. While vasopressors are commonly used to manage hypotension, their use in pregnant patients or parturients presents unique challenges that need careful consideration. One of the primary concerns is the impact on the uteroplacental blood flow. Vasopressors work by constricting blood vessels to raise blood pressure, but this vasoconstriction can also reduce the blood flow to the uterus and the placenta. Adequate blood flow to the placenta is crucial for delivering oxygen and nutrients to the baby, and any reduction can potentially lead to fetal distress or other complications. Another challenge is the altered pharmacodynamics in pregnancy. During the pregnancy, the body undergoes significant physiological changes, including increased blood volume and changes in hormone levels. These changes can make pregnant women more sensitive to the effects of vasopressors, leading to unpredictable responses. This increased sensitivity can complicate the management of blood pressure as it becomes harder to achieve the right balance without causing adverse effects. These factors highlight why finding alternative strategies for managing hypotension, such as the use of ondansetron, is so important in obstetric anesthesia. Let's now look at the evidence supporting the use of ondansetron for preventing hypotension during spinal anesthesia in parturients. One significant piece of research is a randomized controlled trial that compares various interventions, including colloids, crystalloids, phenylephrine, ephedrine, and ondansetron, against a control group. This extensive trial involved 125 studies encompassing nearly 9,500 women undergoing spinal anesthesia for C-sections. The findings revealed a notably lower incidence of hypotension in the ondansetron group, with a stronger effect observed in those who received a 4 milligram dose. Additionally, a systematic review evaluated the efficacy of different doses of ondansetron, ranging from 2 milligrams to 8 milligrams versus a control group. This review also demonstrated a significant reduction in hypotension among those received ondansetron. Interestingly, the 4 milligram dose consistently showed the most pronounced effect in preventing hypotension during spinal anesthesia. These studies provide compelling evidence that ondansetron can be an effective strategy for reducing the risk of hypotension in parturients, particularly at the 4 milligram dosage. In conclusion, the prevention of hypotension during spinal anesthesia is critical, particularly in obstetric patients where maintaining stable blood pressure is essential for both maternal and fetal well-being. The evidence we've reviewed today highlights the potential of ondansetron as an effective alternative to traditional methods such as vasopressors in reducing the incidence of hypotension, especially at 4 milligram dose. As healthcare providers, it is important to consider the implication of this research in our practice. I encourage you to apply this knowledge when managing spinal anesthesia in parturients to improve patient outcomes. I also encourage you to share these findings with your colleagues to promote evidence based practice and to support and engage in further research to refine our understanding and optimize the use of ondansetron in clinical settings. By staying informed and proactive, we can continue to enhance the safety and effectiveness of our anesthetic techniques, ultimately benefiting our patients. Thank you.